Well, I don't remember actually getting the concussion. When I came to, I was pretty confused. I have really had no idea what had happened. But I knew something right away wasn't right.
At school, Jack did pass the impact test by the trainers, which most times would be a green light for those kids to head right back out there. He just didn't feel right.
The better you know him, the more you can recognize there's a little something wrong with this guy. And with this knowledge now and the awareness, this might be a symptom of a concussion. Let's go check with somebody that really knows.
A concussion is much different from most injuries because other injuries you might be able to tape up. You can take Motrin to help with the pain, stuff like that. You can't do any of that with your brain, and your brain is going to be with you for the rest of your life, and it's one tool that is not replaceable.
We test people in terms of how they function. Can they keep their balance? Can they read quickly? Can they move their eyes in all directions quickly, accurately? Do they absorb information when they read it?
A neuropsychological evaluation is much more detailed testing, and it's given to students and adults to more precisely identify what are the symptoms of a concussion, both from a cognitive standpoint and behavioral standpoint.
Clint worked with Jack, and I was able to be in the room and observe all of his testing, and it was amazing because Jack thought he was doing great. He was just buzzing right through, okay, I'll do that, I'll do that. And as I was observing though, I could see, wow, like he's a little off.
I was made aware that Bryn Mawr Rehab Hospital had a specific center for dealing with concussions. My daughter-in-law let us know he was coming here for rehab, and I said, that's great, because I have such confidence in this facility, having had visited friends here that have experienced different forms of head injuries.
When it came to the care, the doctors, the clinicians, the therapists were all fantastic. They were able to explain everything to me in a way that I would understand it, not using all the medical terms.
Right away though, it was, we're gonna work with you, we're gonna work through this, and we're gonna show you how to do it. And it's gonna be a positive outcome. And he was on board.
I was tested on a Dynavision board, which had lights all over it, and one would light up, and I would stare straight ahead, and I would have to react using my peripheral vision to tap the lights that lit up.
What makes the Dynavision machine unique is the fact that the size of the board encompasses all the quadrants of your vision. But when testing reaction timing, you need to test more than just the central field. The peripheral field is important too. And this machine helps us do that. It gives us a way to measure in a benchmark or baseline sense how a person does, and also how they change over time with treatment.
So I think the great thing about Bryn Mawr Rehab Hospital is that we have all of the services needed to treat a concussion under one roof. We have physical therapy for vestibular symptoms. We have occupational therapy to treat the vision deficits that we know happen. We have cognitive and speech therapy to work on compensatory strategies to get our young folks back to school sooner. We have psychology for the emotional component of a concussion. And we have neuropsychological assessment, which is the gold standard in terms of understanding the nature and the severity of any behavioral manifestations after a concussion.
Here at Bryn Mawr Rehab, I pride myself on how well we communicate as a team. From speech therapy, physical therapy, occupational therapy, as well as psychology. We frequently meet, if not every week, sometimes multiple times a week, just to discuss what's going on in every aspect of our patient care.
We're on the cutting edge here at Bryn Mawr Rehab because we're continually keeping up with the latest research and technologies, and we are passionate about getting our patients better.
Besides that, when I was at school, I was able to call back an email, and they were very helpful with, explaining my symptoms and any help that I needed.
15 years ago, when we used to call schools and say we'd like to come and do a presentation about concussions, the response we had was, oh, we're really not that interested. It's not really something that we experience all that much. Nowadays, athletic trainers really do want to know this information now in order to how to better treat their students.
Message is getting out there, and more coaches and athletic trainers are becoming more aware, but there's still often quite a delay between when the injury occurs and when they've actually been evaluated by a physician.
I think it's really neat watching an athlete who's been so sick and struggling getting back on the field and playing, and the smile on their face and the smile on the parent's face that this child has finally overcome this great obstacle. So it's really cool to watch them. And they just beam from ear to ear, and everybody knows that this kid has worked so hard to get there. So that's really cool to see.
For concussions, I would absolutely recommend Bryn Mawr Rehab. The care that I received was fantastic. It was possibly the best care I've ever received for really any injury.
Let him play. Let him play. But if something does happen, you have a place to go.